Absolutely yes. And so here's a principle that one of the reasons I wanted to make this video was to really impress upon people, everyone in general, but especially the patients that come to our clinic, is that we used to talk about a ketogenic diet in a general way and say, oh yeah, high fat, high protein, and low carbohydrates. But here's the therapies we do over here. The thing that has changed is the ketogenic diet has become a pillar of our therapies. It has become literally a therapy unto itself that is an initial step that helps all of our other therapies work better. Now, of course, the first question is, what is a ketogenic diet? The really important thing to understand here is there's a lot of misleading information out there online about ketogenic diets. And in general, it's a higher fat, higher protein, lower carbohydrate diet. But there are greater details to incorporate in order to use it as an actual therapy. And that is a restricted caloric content. So it's not just an unlimited amount of fat and protein and no carbohydrates. It's a very specific amount of fat, a smaller amount of protein, both of which are calculated based on a person's age, sex, and body size, with minimal to no carbohydrates. So what is a ketogenic diet? That's what it consists of, but what does ketogenic mean? Ketogenic means that the goal of the diet is to trigger your body to start producing ketones. And here's the crucial reason. Cancer, as we've discussed in many other parts of our website and my lectures and things, cancer cells themselves have been proven 100 years ago to use an abnormal way of burning sugar that doesn't use oxygen. And the weakness in this form of energy production is that it's 18 times less efficient at producing a given amount of energy out of a given amount of sugar. And so what that means in a practical level is cancer cells require, on a moment-by-moment basis, require 18 times more sugar than normal cells. This is known in conventional medicine for 100 years. Otto Warburg, MD, PhD, German physician, was given a Nobel Prize in medicine in 1931 for proving this principle. So if you take that concept and the cancer needs to have sugar, a large amount of sugar on a regular basis, it is impossible to cure your cancer by not eating sugar because your brain requires sugar on the same level of intensity that it requires oxygen. So if we cut your blood sugar down to 0, it would kill the cancer, but it would kill you too. So we don't do that. But the intricacies of the biochemistry are such that if you can trigger your body to produce what's called ketone bodies or ketones, the brain and every other normal cell in your body can switch its metabolism over to burn ketones for energy in the presence of a relatively lower blood sugar. The body will always prefer the sugar, but if you force your blood sugar to go into the lower range of normal, I'm not talking below normal, but in the lower range of normal, 60 to 80 blood sugar, and simultaneously trigger the liver to start producing ketones, which it will do in the presence of adequate amount of fat. Now we can discuss the pluses and minuses of fat in the blood as far as heart disease and everything else. Those are whole other arguments. But if you can trigger your liver with the proper diet to start producing ketones, your other normal cells and your brain cells in your body literally run like a Ferrari running on high octane gas. Cancer cells are weakened because they cannot burn ketones. They must have a regular supply of sugar. So here's the exciting part. Recent research by some PhD doctors, one of whom is formerly from Yale, and now at Boston College, took a population of mice with the most aggressive form of brain tumor, put them into ketosis, as it's called, ketogenic diet, and treated them with very high, what's called oxidative therapies. The goal of oxidative therapies is using certain forms of oxygen to create a storm, it's called, of free radicals. Free radicals are free oxygen molecules that are formed in every one of our normal cells every day by normal metabolism. And consequently, our normal cells have been forced to develop or evolve mechanisms to neutralize these free radicals because they are damaging. The neutralization of free radicals is caused by compounds called antioxidants. I'm sure you've heard that term before. But what we've discovered let me tell you the results of the research first, and then I'll tell you why it worked. The results are that 100% of these mice had their tumors shrink up and disappear. There was zero toxicity from this treatment. And the reason it works is because this abnormal way of burning sugar without using oxygen does not create free radicals. So cancer cells have never had to evolve antioxidant pathways. And so they don't know how to deal with free radicals, and the free radicals kill them. But a cyclical way of administering these therapies, which we have developed in the clinic, kill the cancer cells, but then through the use of appropriate antioxidants in cycling through this therapy, allows the normal cells to recover from the free radical storm every night, with the result that the tumors shrink up and disappear.